All right, everybody, this is the third part in our series of the PACU RN assisting as the block RN. And I just wanted to review a few key pieces after the patient has received their catheter insertion. So as you saw in the previous video, myself and Dr. Jendal worked to get the patient with the catheter inserted. Dr. Jendal walked us through the entire process on her end. We assisted and we cleaned up the patient at this point. Overall review, part one of our series was learning how to set up our supplies on our tray table and our sonogram. Part two was the insertion of the catheter, and this just talks about the components after that. And then there's a bonus video on how to actually hook up the on-cue pump itself, so you'll need to watch that as well. So after the procedure, the patient is cleaned up, drape removed, those sorts of things. And a lot of times there's just like a little bit of blood at the site, so we can help make sure with gauze if we need to. We clean the machine with a cavi wipe, as I've mentioned, and you can keep that in either the PACU area or we'll ask for it to be taken back to holding. And now we're just getting the patient ready to recover. For recovery for a patient after a catheter infusion, we want to make sure that as the PACU RN, we are monitoring them every 5 minutes for 30 minutes. Reason being for that is this is the most likely time that the symptoms of local anesthetic system toxicity or LAST could show up. A couple of key points about that. All nurses caring for patients with the continuous catheter infusions are expected to take the LAST training in HealthStream. Key pieces that we are looking for here, symptoms, are if there is a change in their heart rhythm, blood pressure, dysrhythmias, those sorts of things. So we have our patients on a heart monitor at all times. We have our blood pressure cuff and our pulse ox going, running at least Q5 minutes. And then we also have 2 liters of oxygen running as well by nasal cannula, just to ensure that if something were to happen immediately, they would already have that in place. And then the protocol for notifying someone after is obviously if the anesthesiologist is still at bedside, you would let them know that the patient is verbalizing or you're noticing symptoms of LAST. Again, those are all covered in the HealthStream training. Or you would call a rapid response and the anesthesiologist immediately if they have left the bedside. After you are set to monitor the patient for 30 minutes, you want to pull up the continuous nerve block catheter flow sheet in EPIC or the C&B flow sheet, and you're going to go through that line by line, document those assessments for the patient to include if symptoms of LAST have appeared, the patient's pain level, etc. That is all guided for you in the EMR. You're also going to document that you started the pain medication. I go over this in the last video when you hook up the on-cue pump, but we document this on the MAR. And that is really your role at the end of the block procedure. So you help clean up the patient, you start to make sure that they are on all of the proper monitoring that they need to be. You expect to keep them for at least 30 minutes in recovery. You started your flow sheet and your documentation and your assessment, and you've hooked up the catheter infusion, the on-cue pump. And that's really your role in the end of the block procedure. Thank you so much for watching this video. Again, make sure that you've seen part 1, part 2, this is part 3, and then the on-cue video as well. Thank you.